Hey y'all, I'm sure you guys have heard that we are on a contrast shortage. Contrast is used in CT to highlight vessels and organs so that they can distinguish the anatomy a lot better, the radiologists. It's iodine. So a couple weeks ago, maybe a month or so ago, the manufacturer warehouse, whatever it was, in I believe it was Shanghai, exploded. So now we have a contrast shortage. And at the hospital I'm currently at, so I'm at two hospitals right now. One hospital uses IsoView and this other hospital uses Omnipeg. So for the Omnipeg hospital, it's hitting them a lot harder where they actually have to change the protocols. And I think it's so sad because some of the patients come in not knowing that by default the regional protocol is for them to change certain studies, like if they have abdomen pain or diverticulitis or appendicitis. Even though the doctor orders it as a with contrast study, we automatically change it to without. So this means some of the patients come in NPO, which means they haven't eaten all morning or all day or drank anything, so they're starving. And then some of them have to have labs to make sure their kidney functions are well. And sometimes, labs are good to check to see where your body's at, but sometimes it's specifically for the scan because they're getting a contrast study. We don't want to hurt their kidneys if it's not functioning well. So that means they pay for their lab and it's for no reason. And then they're hungry, and now we just do it without. And just recently, which I feel really horrible about, this patient came in the other day and we automatically changed it to non-con. And then they were called back because the radiologist saw something significant that they couldn't distinguish. So called the patient back to have it scanned with contrast. So it's just an inconvenience and it sucks. And I don't know what the solution is to it, but just be careful, I guess. Ask questions about the contrast if you do have a CT contrast study. Is it gonna deter anything? Is something gonna happen? Are you gonna have to be called back later on? Should you consult someone first, get more information? I don't know. Just be mindful of it and know that we're short on contrasts and everything else. I just found out that we're short on labels for the post office. Nowadays baby formula. It used to be toilet paper. What else are we gonna be short on?